Hello viewers, I'm Dr. Kavita M. Triplum College of Nursing, Chennai. Now I'm going to discuss about ethical and legal issues in nursing. The objectives of this video are, at the end of this video, viewers will be able to understand the ethical principles, understands ethical issues in caring patients, appreciates the importance of ethical and legal issues in caring patients, develops skill in handling medico-legal cases, knows various ways to resolve ethical problems, identifies various legal safeguards for nurses. So let me introduce the topic of ethical standards and the legal standards. Ethical standards are usually based on human principle of perceiving right or wrong, whereas legal standards are based on the written laws given by the statutory bodies. According to Immanuel Kant, in a law, a man is guilty when he violates the rights of others, whereas in ethics, a man is guilty if he only thinks of doing right or the wrong. In caring any critically ill patients, it is inevitable that ethical issues will arise. Patients often have complex medical conditions, multiple providers, and uncertain prognosis or treatment plans. This can lead to conflict and moral distress among patients, family, healthcare providers, and support staff. Generally, ethical issues occur when there is a conflict of values between individuals or within individuals concerning which of the possible options should be chosen. The ICU environment is stress-prone condition and difficult ethical issues emerge between those who are involved in the care of critically ill patients. So what is ethical decision making? Ethical decision making is the process of evaluating and choosing best alternatives in a manner consistent with ethical principles. There are two steps in process of ethical decision making. That first one is identifying the source of decision making. As in nurses, we usually rely on the doctors or the treating consultant in taking any decisions regarding the patient care. The second process is effective communication among the team members and with the patients and the family members. So let me tell you about few ethical principles. The first one is the autonomy, which is a patient's right to self-determination and to make personal medical decision. Next one is the beneficence, which is the medical treatment should be provided to benefit a patient. And next one is non-maleficence, the principle of doing no harm to the patient. Justice, similarly situated patients should be treated similarly. The distribution of resources should be fair and based on medical need and the likelihood of a good medical outcome. The next principle is the veracity, which means truth telling, which requires that healthcare providers should be honest in their interactions with patients. Fidelity means keeping one's promises. The nurses must be faithful and true to their professional promises and responsibilities by providing high quality, safe care in a competent manner. The last one is the negligence, the omission to do something that a reasonable person would do, or a person would do something that he is not supposed to do it. So let us take a quick quiz on this one. Which of the following ethical principle guides healthcare decision? Autonomy, beneficence, non-maleficence, and justice. Hope you have identified which is the ethical principle guides the healthcare decisions. Yes, it is an autonomy. Autonomy is the ethical healthcare decision should be based first and foremost on the principle of autonomy. Individuals have the right to make their own decision. Next, we'll see certain ethical dilemmas in critical care units. These are grouped into three categories: end-of-life decisions, patient care issues, and human rights. End-of-life decisions include CPR, that is DNR, do not resuscitate orders, palliative care, euthanasia, withdrawing or withholding care, and futile care. So what is this palliative care? Palliative care is the end-of-life care which usually given to relieve pain and ease dying process. In palliative care, no effort will be taken to cure the disease condition, where the patients will be at their terminal stage or before the previous stage, where they will be given the symptomatic management to keep them comfortable. Euthanasia, which means mercy killing. There are many types of euthanasia: active euthanasia and the passive euthanasia. Active euthanasia means using the pharmacological measures to end the life of an individual. Passive euthanasia is withdrawal of the life support to patients in a permanent vegetative state. The next legal issue is the cardiopulmonary resuscitation decisions. Ethical questions arise on use of CPR and emergency cardiac care. The do not resuscitate order is still not documented legal practice in India. It is a verbal communication between the clinician and the patient's relative or caregiver. But for the legal safeguards, we need to document that the do not resuscitate orders are being given and the decision is being taken by the family members or by the patient. Resuscitation efforts are used to reverse the clinical signs of death, that is, loss of spontaneous respiration, loss of cardiac function, and unconsciousness. A generally accepted position in that resuscitation should cease if the physician determines the efforts to be futile or hopeless. According to American Heart Association, healthcare providers may stop CPR when 30 minutes or 15 minutes of advanced life support have been attempted without restoration of heart rate and breathing. The autonomy of the patient also remains a weak concept in certain situations. The law is silent or ambiguous on most issues related to end-of-life care. In most cases, healthcare expenses are entirely borne either by the patient or by the patient's relatives. So the financial status of the patient appears to be the deciding factor in DNR. Withholding or stopping resuscitation effort is ethically and legally appropriate. The patient or surrogate has previously made his preferences known through advanced directives. So we should be very clear in what situation should resuscitation efforts be used, how long the effort should continue. Hope with this discussion, you should have understood what is the situation and when to terminate the CPR. There are certain issues in DNR or CPR. Should a patient be coded or when he should be taken the DNR? Do not resuscitate order is needed to initiate a code. Does family presence during code is promoted? We need to be asking these questions when we initiate the DNR orders. Many issues surround initiating or withholding CPR in the event of cardiopulmonary arrest. A DNR is required to not initiate a code. Decisions regarding DNR status should be made prior to a code and not during the code. Advanced directives are useful in guiding decision-making prior to code. Families are encouraged to be present during code if it is their wish. The next issue, what we come across is the withholding or withdrawal of life support. Withholding means never initiating a treatment, whereas withdrawing means stopping a treatment once started. Which one is easy? Is it starting a treatment or stopping a treatment? Communication is very, very important to understand the real meaning of withholding or withdrawing when we treat the patients in critically ill state. Healthcare professionals may find it emotionally more difficult to withdraw a treatment than to withhold the treatment. On the other hand, it is often important to start a treatment to evaluate whether it works. Until a diagnosis is confirmed, it is better to start the treatment and later stop if it is ineffective. Decisions about treatment at the end of life are often difficult and best made after careful discussions between the healthcare professional and the patient or the family members. The final decision reflecting the patient's wishes should be supported by the nurse and other members of the healthcare team. The nurse is morally permitted to refuse to participate in withholding or withdrawing treatment from the patient as stated in section 5.4 of the Code of Ethics. The third one is the legal and ethical issues, informed consent. Informed consent is based on the principle of autonomy, which is a voluntary agreement or the permission or the compliance given by the patient to perform certain act on his body. There are 4 elements in informed consent are voluntariness, capacity, knowledge, and decision making. Consent problems arises because patients experiencing acute life-threatening illness that interfere with their ability to make decisions on treatment and participation in clinical research. There are 2 types of consent: implied consent, where the patient voluntarily participates in giving treatment without any verbal or the written order. It is like every day doing a treatment to the patient. Whereas expressed consent or verbal or written permission obtained from the patient to perform certain treatment on him. There are certain points needs to be considered in taking or giving consent. Consent must be given voluntarily. If the patient is not mentally capable, informed consent should be obtained from surrogate or legal next of kin. It should be given by a person of sound mind and above the age of 18 years. It requires the disclosure of basic information considered necessary for decision making. Patient providing consent should be free from pain and depression. Next, we'll see the legal decisions in critical care. So far, we discussed about the ethical issues. Now we are moving into the legal decisions. The common legal decisions are medical documentations, use of restraints, declaring brain death, organ donation, and autopsy. So let us discuss one by one. Medical legal case. A medical legal case is any case where the discipline of medicine comes to help the legal fraternity in its discharge of duties. The medical legal case should be registered as soon as physician suspects foul play or case brought several days after the incident. Healthcare professionals have to be very cautious in dealing with medical legal cases. MLC is received in hospital by or any case brought by police for the purpose of examination and reporting or any case referred for expert management and advice. Request of the patient or relatives or friend for not registering the cases as medical legal should not be accepted. The MLC should be registered as soon as physician suspects foul play by the patient or the family members. The following cases should be considered as MLC and to be intimated to police regarding such cases: all cases of injuries, all cases of burn, alleged cases of assault, all cases of suspected or evident of poisoning or intoxication, cases referred from court, cases of suspected or evident count like criminal abortion, cases of unconscious or comatose patient where its cause is not natural or not clear, cases brought dead or dead on arrival or sudden unexpected death, cases of suspected self-inflicted injuries or attempted suicide. The most important considerations in MLC are notification to police, collection and preservation of samples, and recording of dying declaration. So we need to be very careful in handling above cases and document everything very precisely and in clear manner. So let us see documentation in medical legal cases. The proper medical documentation is legal necessity. A good record should be correct, clear, comprehensive, chronological. It is the fact that good records are indispensable for proper care and treatment of patients. Consent from patients before carrying out any procedure is mandatory, legal, ethical, and moral requirement. Similarly, the document, once prepared, has also to be preserved for a specified period of time. If any request is made for medical records, either by patient or authorized attendant or legal authorities, the document shall be issued within period of 72 hours and refusal to do so would be misconduct. The following medical documents are almost important as far as legalities are concerned: specialist consultations and referral slips, nurse's record, treatment record, TPR chart, BP monitoring chart, intake output chart, and operative notes, anesthetist notes, progress report, final diagnosis, discharge summary, and follow-up notes, death certificate, medico-legal reports, medico-legal investigation reports, all are of immense importance and have to be very specific, clear, comprehensive. So nurses' documentation plays a vital role in many of the medico-legal cases. Let us move into the next legal issue, that is use of restraints in caring patients. Restraints are interventions that limits a person's freedom to move. It can be physical or chemical. Researchers reported that use of physical restraints can lead to skin trauma, muscle atrophy, nosocomial infection, constipation, incontinence, limb injury, contractures, depression, anger, decline in functional and cognitive state, and increasing agitation. Considering the physical, psychological, and ethical aspects of physical restraints, it is advocated that such is only used when all other methods of managing the problem have failed, employed with caution and as a least resort and use least restrictive method possible. So what are the decisions regarding life-sustaining treatment? There are two levels of treatment is considered. One is the ordinary care, which includes non-invasive and treatments like providing nutrition, hydration, antibiotic therapy, or any routine care which is being provided to treat the patient. There is another type of care called the extraordinary care, which is a complex, invasive, and experimental treatments like CPR, advanced life support, dialysis, and other therapies, which usually taken to improve the condition of the critically ill patient. However, ethicist believes that any treatment can become extraordinary whenever the patient decides that the burden outweighs the benefits. Next issue is the futile care. Futile care is the continued provision of medical care or treatment to a patient when there is no reasonable hope of a cure or benefit. Perception of futile care among caregivers in intensive care unit regarded that respondents felt that futile care was provided because of family demands, lack of timely or skilled communication, or a lack of consensus among the treating team. So we need to be very clear when we are providing futile care where we find the treatment has no effect in improving the patient medical condition. The next issue is the advanced directives, which is a provision for healthcare decisions in the event that in the future he or she becomes unable to make those decisions. These directives may also designate a specific surrogate decision maker, that means a next of kin or a family member who will be regarded as decision maker, who then has ethical and possibly legal standing to make medical decisions for the patient. The next legal issue of importance is declaring brain death. There are three essential findings in brain death are coma, absence of brainstem reflexes, and apnea. The declaration of brain death requires a physician not involved in the patient treatment to document brain death and another physician to confirm the findings. Nurses has to be very careful when the documentation of brain death is being done by the physician. Make sure the treating physician has no role in declaring brain death. The next legal issue is organ donation. The decision of organ donation can be made by a provision in a will or by signing a card-like form. Nurses may serve as witnesses for people consenting to donate their organs. Autopsy. An autopsy or postmortem examination is an examination of the body after death. The law describes under which circumstances an autopsy must be performed. For example, all medical legal cases should undergo autopsy. These are some of the legal issues of importance in caring patients with medical conditions. So let us look into certain ethical issues of most concern in nursing practice. The most frequently cited ethical issues reported by the nurses surveyed were protecting patients' rights and human dignity, providing care with the possible risk to your health like TB, HIV, or any violence, respecting or not respecting informed consent to treatment, staffing patterns that limit patients' access to nursing care, use or non-use of physical or chemical restraints, staffing patterns that limited patients' access to nursing care, prolonging the dying process with inappropriate measures, working with an unethical, incompetent, impaired colleague, providing care with a possible health risk, not considering a patient's quality of life. So when we come across this situation, we must be very careful in making ethical decisions. We should remember the process of ethical decision making and we have to make the decisions. So how we can solve the ethical problems? There are ways available to solve ethical problems. Few of these are gather the relevant facts and identify the decision maker or the makers and the stakeholders. Identify the ethical problem or the problems involved others in the process and use consultation resources as appropriate. Analyze the problem using ethical guidance and resources. Deliberate about the action alternatives in light of guidance. Choose one and justify the choice. Evaluate and reflect the decisions taken. There are also certain ethical dilemma warning signs. When we come across the patients with ethical decision making, we need to identify which are all the warning signs that we are in dilemma of deciding the ethical decisions. A person may be emotionally charged, a significant change in the patient's condition, confusion about the facts, hesitancy about what is right or what not to be done, deviation from customary practices in the area wherever we are working, need for secrecy regarding proposed action. So when we look into these decisions, these situations, we need to be very careful that we are in dilemma of making the ethical decisions. So there are 4 S that will help us in making the wise ethical decisions. So their resources developed by the American Association of Critical Care Nurses stated there are 4 A's or sequential steps in raising one's awareness and committing to action. First one is the ask. Whenever we are in ethical dilemma, reflect to become aware of your feelings of moral distress. Are you and your team members experiencing moral distress? Next one is the affirm. If you are experiencing a moral distress or not, validate your feelings with others and make a commitment to address moral distress. Next, assess the degree of your distress and your readiness to act. Once you are ready to act, make a personal and professional action plan, carry it out and act to sustain. If you are uncertain about taking action, the 4 R's also will help you to clarify. The first one is the relevance. In what ways and to who is the issue important? Risk. What are the risks of taking action and of not taking action? Reward. What benefit can be obtained by acting and various course of action? Roadblocks. What are the barriers to taking action or a particular course of action? So when we consider or when we use these 4 A's or 4 R's, we will be able to make a good ethical decisions in taking care of patients. So though nurses are looking after these various issues in ethical or legal standards, there are also certain legal safeguards that are available for nurses to protect them. These are informed consent, collective bargaining, competence practice, licensure, patient education, executing physician's order, documentation, professional liability insurance, good Samaritan law, adequate staffing, and patient's bill of rights. When these safeguards are used or utilized properly, this will act as a safeguard for nurses when they are in the ethical or the legal issues. So to conclude this video, the ethical and legal responsibility of nurse working in critical care or any areas of hospital has increased. Nurses must maintain and continually update their knowledge base and clinical competence. Failure to do so could not only cause harm to patients, but could also put nurses and their employer at risk for allegations and professional negligence. As a registered nurse working within the healthcare industry, it is important to consider all sides of the ethical debate and to always act within the law and with the best interest of the client in mind. So these are some of the ethical and legal issues in brief we have discussed in this video. So these are some of the references I have made in preparing content for this video. If you have further doubts, you can have these references to study in detail. Thank you.